Your pet's recovery from surgery doesn't end after leaving our care. They'll need your continued support at home. Here are some things to keep in mind. Depending on the procedure, it's important to restrict your pet's mobility for at least a week after surgery. It's critical that your pet avoids running, jumping, and any other activity that could damage the wound. They should also remain inside except for short, leashed potty breaks. Since they'll be spending a lot of time resting, be sure they are comfortable, being mindful of temperature and noise levels. It may also be helpful to confine your pet to an area of your home where their activity can be limited, such as an empty room or even a large crate or kennel. Anesthesia used during the procedure can take up to 24 to 48 hours to completely exit your pet's system. Contact us if your pet continues to act drowsy after that. You can offer your pet half their normal meal portion a few hours after arriving home, and if they have the appetite, the rest about an hour later. Dividing up this first meal decreases the risk of nausea and vomiting. Unless we've instructed otherwise, water shouldn't be restricted. An area on one of your pet's front legs may have been shaved when we administered an anesthetic or sedative. If this area is bandaged, you can remove the bandage the day after surgery unless we instruct otherwise. Don't be alarmed if your pet has a mild cough for a few days after surgery. Their throat may have been mildly irritated by a tube that provided oxygen and anesthetic during their procedure. Contact us if coughing continues or worsens. Your pet may instinctively try to clean their wound by licking it. For this reason, you may have been provided an Elizabethan collar, e-collar for short. While many pets resist wearing an e-collar at first, most pets will tolerate it after a while. Resist the urge to give your pet a break from the e-collar, as it only takes a few seconds for a pet to remove stitches or staples, or otherwise damage their wound. If your pet manages to remove stitches or staples, call us immediately. A normal incision should be clean, with edges together. The skin surrounding the incision should appear normal or slightly red or pink. Bruising may also be present, or can appear a few days after surgery. You may also notice a small amount of blood around the wound for up to 24 hours, especially if your pet is active. Call us immediately if blood drains constantly or excessively, if blood is present for longer than 24 hours, if there's an unpleasant odor, or if there is excessive swelling or redness of the skin. If staples were used during your pet's procedure, we'll remove them during a follow-up visit usually scheduled 7 to 14 days after their procedure. If sutures were used during your pet's procedure, care may vary depending on the type of suture used. We will let you know if removal is necessary. If your pet was sent home with any medications, be sure to follow the instructions on the label carefully. If you are having difficulty giving the medication to your pet, let us know so we can help. While recovering from surgery isn't much fun for you or your pet, it's critical for helping your pet return to normal health as quickly and safely as possible. Let us know if you have any questions. We are here to help.